We are now approximately 6 to 7 weeks from a decompression of the tibial nerve in the ankle for tarsal tunnel syndrome, with the calcaneal nerve to the heel, the medial plantar and lateral plantar nerves to the sole of the foot. In addition to this, the patient actually had a plantar fascia release through an incision right here at the end of the scar. This is actually complication of previous treatment for plantar fascia. This is actually this redness and skin thinning is from a steroid injection. The point I make about this foot is that she's about 6 weeks from a year and a half of chronic pain. She was treated for plantar fasciitis, and her podiatrist, who was very astute, after not getting better for an extended period of time, began to ask the question of whether or not there could be something else in addition to plantar fasciitis. So one of the clues of that was the fact that her pain was truly initially in the shape of the whole heel. So her pain covered a lot of the heel, not just the traditional area of her plantar fascia, which is right here, and going across. So she had some symptoms of discomfort and burning into the whole heel, and actually she didn't like to touch the back of her Achilles tendon, which was sort of electrified, if you would, causing tingling and really significant burning. Those are clues that she has something in addition to plantar fascia. So if you're a patient who has a diagnosis of plantar fasciitis and have been treated with conservative therapies, using orthotics, using injections, using stretching, and you've gone through a number of situations for treatment, you may want to ask the physician, what else could you have? And that answer is tarsal tunnel syndrome, specifically compression of the calcaneal nerve as part of it. So can you tell us, if you don't mind, what your pain was like prior to the surgery, and then tell us what it's like now?
Before the surgery, I had sharp pain. If you go like this, I would actually call out because of the pain was so severe. There was a lot of pain down in this area, which I thought was the plantar fasciitis. The pain that was shooting up around here, my podiatrist determined that it was probably an additional cause, and she sent me to the Dillon Institute.
And she did order, your podiatrist was very astute, she ordered an EMG, nerve conduction study. Those can be very helpful. Sometimes they can be less helpful, but yours was positive. And when we tapped on you very gently, and when your doctor tapped on you, you would get electricity shooting down into your ankle. That is not tarsal tunnel syndrome. That is not plantar fasciitis. When anyone thumps on the nerve with the finger gently and it shoots electricity down your foot, that's consistent with tarsal tunnel syndrome, or a pinched nerve in the ankle. So we've been operating with a colleague of ours for several years now for patients who have both symptoms of plantar fasciitis and tarsal tunnel. And tell us how you've been doing over the past few weeks. What have you noticed different?
I have no pain at all.
No pain at all?
Zero.
And how far were you able to walk?
I have worked my way up to walking about 3 miles. I have purposefully walked on hard surfaces just to see, because that used to be very painful for me. I have no pain from that whatsoever. I'm a very happy person.
All right. And your pain was present for how long prior to this?
A year ago, April.
About a year and a half ago, roughly?
Mm-hmm.
All right. Would you consider this fairly successful then?
Yes.
All right. Thank you.